Well, layoff notices have been sent to more than 36 employees at Laurel Hospital. It's the first wave of a plan to change the facility from a full-service hospital to an ambulatory care center. The move is sparking outrage from area leaders, medical workers, and patients.
38 employees received layoff notices as Dimension's healthcare system makes due on its decision to begin closing Laurel Regional Hospital. First to go will be labor and delivery nurses in the maternal and child health unit.
Some of these moms that come in an emergency situation, you have 20 minutes to a half an hour to get those babies out, or you lose quality of life. If you delay them by bringing them here and then stabilizing them and trying to transfer them, that's the beginning of somebody's life that you've just jeopardized.
Dimensions may think it's a done deal.
Laurel Mayor Craig Moe recently sent a letter to Prince George's County Executive Rushern expressing his concern about the impending closure and the lack of transparency in the decision-making process.
We again call on County Executive Rushern to engage the community and keep Laurel Regional Hospital as a full-service hospital, or allow it to be sold to another medical facility that will allow the full-service Laurel Regional Hospital to have its bright future.
State officials expressed their outrage as well during a press conference this morning in Laurel.
You would think that the state delegate, who is, I'm standing right in front of you, the chair of the Public Health Committee, would know that prior to making that decision, if they knew they were going to do it, that they would basically table it, convene a meeting, have a discussion with us about possible solutions. They did not.
Unless and until we have a plan that in fact preserves and expands medical service to this area, I will not support an additional dollar of state money for the Dimensions healthcare system. Thank you.
Officials are threatening to withhold approval of the certificate of need for the county's new regional hospital unless Dimensions board and the county executive sit down to discuss the impending closure with the community.
And in an emailed statement, Dimensions Healthcare says that critics may be well-meaning in their opposition, but they're advocating an approach that is out of date and not financially sustainable. The organization says it announced plans more than a month ago, which include phasing out the majority of inpatient beds later this year. Behavioral health, rehabilitation, and chronic care beds will remain in place until the new ambulatory care facility is built in 2018. Well, the impending shutdown of Laurel Hospital is also causing major concern among seniors in the area. A Prince George's council member calls the issue a matter of life and death for that group. Councilwoman Mary Lehman tells CTV that the hospital is essential to elderly residents due to its proximity. Lehman adds that while she has been a proponent for the regional medical center to be built in Largo, she recognizes that it does not cater to seniors in northern Prince George's.
Is I need to know that there's something really close by where I can be taken for basic life support or advanced life support. As I understand it, if Dimensions is even sincere about going forward with an ambulatory care center, the ER would be limited service and it would be basic life support only, because you have to understand there would be no beds to send people to. For somebody that's in the process of having a heart attack or a stroke or any other life-threatening situation, they're not going to be able to be brought here, or if they are, as the OB nurse said, it's going to be a waste of time, and then you're really going to be risking someone's life.
Laurel Regional Hospital is the only full-service hospital in northern Prince George's.